If you work in a clinical setting, you know that managing a patient's stress is a huge part of the job, right? It's a constant battle. But what if one of the best tools you have isn't a drug, but a melody? Today, we are going to dive right into the neuroscience of music and talk about how you, as a healthcare professional, can actually use it to change how you care for your patients. Okay, so we've all seen it. A patient is stressed out and it just complicates everything. It shoots up their cortisol levels, the body's main stress hormone. It raises their blood pressure, and it can seriously get in the way of healing. So we're always looking for better ways to manage this. And that's where music therapy is really starting to shine as a powerful science-backed solution. So that brings up the big question, doesn't it? How can something as simple as sound become a real legitimate tool in the clinic? It sounds a little abstract, I know, but the answer isn't about feelings or philosophy. It's actually about concrete biology. It's about the brain's direct chemical reaction to music.
Yep, this is where the magic happens. The whole thing is driven by the real, measurable effect that sound has on our brain chemistry. This isn't some kind of mystical thing. It's just pure biochemistry in action.
This is really the heart of it all. See, once you understand the why, music goes from being just a nice distraction to a predictable, reliable clinical tool. So let's get into it. Let's look at exactly what is happening inside a patient's brain when they're listening to music. Just look at this comparison. It's pretty stark. On one side, you have the stress response, which floods the body with cortisol. But when you introduce the right kind of music, it launches this amazing counterattack. It actually pushes those cortisol levels down. And at the same time, it boosts dopamine. That's our reward and motivation chemical. And serotonin, our natural mood stabilizer. It's literally a neurochemical reset. And this chart just makes it crystal clear. This isn't just a theory, It's a measurable physiological change. Bringing calm music into the room can seriously lower a patient's cortisol levels, fighting that stress response directly at the chemical level. We can actually see the chemistry shift. It's incredible. And let's be super clear here. We're not just talking about, turning on the radio in the waiting room. Music therapy is a recognized, evidence-based practice. It's used by trained professionals to get specific, targeted results. It is absolutely a legitimate part of the modern therapeutic toolkit. All right, so we've talked about the science behind it. Now for the really important part. How do we take this from the lab and bring it to the bedside? How does all this cool neurochemistry actually lead to better patient care in the real world? Just picture this scenario. It happens all the time. A patient is about to go into a procedure, and their anxiety is through the roof. Now, instead of immediately reaching for a sedative, what if we just introduce some calming music? Well, like we just saw, that kicks off the chemical cascade. Cortisol goes down, dopamine goes up, and the result? It's a real physical change. Their heart rate slows down, their breathing gets deeper, and suddenly the patient is in a much, much better state to handle what's next. But it goes even beyond the pure chemistry. Think about this. Music can be like an emotional mirror. For a patient who's struggling to find the words for their fear or their pain, music can kind of give voice to those feelings. It validates what they're going through and provides a safe outlet, which, as we know, is just so crucial for healing. And it doesn't stop with anxiety, not at all. Music has this deep, almost primal connection to our memory. For patients with dementia or Alzheimer's, hearing a song from their past can be like finding a key. It can unlock memories and a sense of self that seem to be lost forever. It's a really powerful way to help reconnect people with who they are. So you see, the impact of music is so much bigger than just lowering stress. All these positive effects create a kind of ripple effect, improving a patient's entire physical and emotional state in a really holistic way. And the data on this? It's really compelling. We see documented drops in blood pressure, which makes sense with lower stress. Patients say they sleep better, even in loud, chaotic hospital environments. And get this, in physical rehab, the rhythm of music can actually help with coordinating movement and improving focus, which can lead to a faster recovery. This really brings it all home. We usually start the conversation talking about stress and anxiety, but look at how much broader the impact is. It touches their emotional well-being, their physical health, and even something as fundamental as their memory and identity. It is a truly multifaceted tool. So, what's the big takeaway for us, for healthcare professionals? How do we take all this powerful knowledge and actually start using it in our day-to-day work? Well, here it is. In a world full of complex drug interactions and side effects, music is a safe, effective, non-pharmacological tool. It gives us a way to support a patient's healing journey that is both incredibly profound and, at its core,
Fundamentally simple. So I'll just leave you with this thought. The next time you're on your shift, just think about the sounds in your clinic or hospital. The power to reduce stress, to help manage pain, and to speed up healing. It might not be in a bottle or a syringe. It might just be in the very air around you. And that's a powerful reminder of how we can make a huge difference.